So the face is going to be supplied by three branches of the trigeminal nerve, or three divisions of the trigeminal nerve. This is your trigeminal nerve right here. And those branches include the ophthalmic branch, the maxillary branch, and the mandibular branch. And some of the areas that will not be covered, it's the angle of the mandible and the parotid gland, which is going to be supplied by the great auricular nerve, which is a branch of the cervical plexus. The first division, it's going to be ophthalmic nerve, or V1. This is your ophthalmic branch of the trigeminal nerve. And this one supplies the forehead, the anterior scalp, the upper eyelid, and most of the nose. It passes through the superior or orbital fissures, and it comes from this semilunar ganglion. The branches of the trigeminal nerve, ophthalmic nerve V1, include the lacrimal nerve, which supplies the lateral part of the upper eyelid, and the supraorbital nerve, which emerges from the supraorbital notch or foramen and supplies the central part of the upper eyelid, the forehead, and the anterior scalp. Other branches of the trigeminal nerve V1 includes the supratrochlear nerve, which curves around the superior orbital margin, medial to the supraorbital nerve, and it supplies the medial part of the upper eyelid and forehead close to the midline. We also have the infratrochlear nerve, which supplies the medial part of the upper eyelid, and it's the adjacent part of the side of the nose. And also the external nasal nerve, which emerges immediately inferior to the nasal bone, and it supplies the side of the nose as far as the tip or the apex. The maxillary branch of the trigeminal nerve supplies a small part of the nose, the lower eyelid, the prominence of the cheek, upper lips, and the anterior part of the temporal region, and it passes through the foramen rotundum. The branches include the infraorbital nerve, which it's in direct continuation of the maxillary nerve, and it emerges from the infraorbital foramen and gives off branches that supply the lower eyelid, the upper lip, and the ala of the nose. Then we have the zygomatical facial nerve, which is this one right here, and it supplies the skin over the prominence of the face cheek. And we also have the zygomatical temporal nerve, which is this one right here, which supplies the skin over the anterior part of the temporal region. The third division is the mandibular branch, or V3, which supplies the skin of the lower lip and chin, the face cheeks, the temporal region, and a part of the external ear. The mandibular nerve has three branches: a mental nerve, which is a branch of the inferior alveolar nerve, which emerges from the mental foramen, and it supplies the lower lip and chin, which is right here. We also have a buccal nerve, which is right here, and it supplies the cheek, and also an auriculotemporal nerve, which ascends with the superficial temporal vessels anterior to the auricle, and it supplies the parts of the auricle, external acoustic meatus, and also the tympanic membrane, most of the temporal region of the scalp, and the temporomandibular joint. As for the arteries of the face, these are derived from branches of the external and internal carotid arteries. They have terminal branches of arteries that are supplying the face and anastomose freely, and many arteries accompany the cutaneous nerves and have some of the same names as the nerves. We're going to start with the facial artery, which is the one you're observing here in red. This one, it's the main source of blood supply to the face. It branches of the external carotid artery, and it arches over the submandibular gland into the submandibular triangle, and it curves around the inferior border of the mandible, just anterior to the masseter muscle, which is right here. And this enters the face. You can actually, if you put your fingers in that area, you might feel its pulse. And it ascends in a course towards the medial angle of the eye. Now, its branches will anastomose freely with the branches of the maxillary and ophthalmic arteries, and with branches of the facial artery of the opposite side. So some of the branches in the face include the superior and inferior labial arteries, the lateral nasal artery, and the angular artery, which actually the lateral nasal artery comes from this angular artery. And this one anastomoses with the dorsal nasal artery, and this is a branch of the ophthalmic artery. Other arteries to the face include the facial branches of the ophthalmic artery, which branch of the internal carotid artery, and these include the supraorbital artery, the supratrochlear artery, the dorsal nasal artery, the zygomaticofacial artery, and the zygomaticotemporal artery. Additionally, we have facial branches of the maxillary artery, which you can see right here. And some of the branches include the infraorbital artery, the buccal artery, and the mental artery. As for the face, the veins in the face follow a similar pattern as the arteries. The facial branches of the ophthalmic, maxillary, and superficial temporal arteries are accompanied by the corresponding veins. So in here we have the facial vein, and this one begins as an angular vein at the medial angle of the eye, and it descends posterior to the facial artery to the inferior border of the mandible. It crosses superficial to the mandibular gland, and it joins the anterior branch of the retromandibular vein. This one drains into the internal jugular vein after joining the anterior branch of the retromandibular vein, and it communicates with the cavernous sinus via the ophthalmic veins, deep facial vein, and infraorbital vein. These connections represent pathways for the spread of infections from the face to the cavernous sinus.